Hi everyone. Have you had a nipple pain before or blister around your nipple? What's the experience like? Like, what? How did you treat it? How did you take care of the blister or the? There is nothing to worry about if you have nipple pain. Just know the cause of the pain. If you have cut, just examine your breast and know if you have cut on your breast or you are wearing too tight clothes, especially for those that we just put to bath. The breast is made up of adipose tissue, and when you put to bath, there is, because of breast milk, there's always heaviness on your breast. And also, if your child's mouth is really strong and like dragging the breast and all that, it could also exert like cut on your breast. And if you're wearing too tight bra also, so just for you to know if what you're having is a breast pain or nipple pain. And if it is nipple pain, is there a cut on the nipple? If there is cut on the nipple, then you now know what to do next. Now, because most people after giving birth, or even those that have not even given birth, young ladies, they some of them do have this thing, breast milk coming out from their breast. So another thing you should know, is it really a breast milk that is coming out or pus? Because there's a difference between breast milk and pus. If you have had a child before and your breast is bringing out milk, so you should know if it is milk or pus. Because if it is pus, maybe it could be that you are infected. Infection is going on, so you should go for aspiration biopsy. So you meet a doctor, they will take a sample from your breast and examine to know what you are having. And if it is also to ask you to do a test like progesterone test and prolactin to know if it's hyperprolactinemia. Prolactin is an hormone that is also very vital in the role of a breast secretion of a breast milk. So if the prolactin is very very high, so they will know what to give you and how to control it. But if you have given birth before, or you have a cut, you are even seeing a fresh cut on your breast, you can still take care of that cut. If there is no breast milk or pus coming out from it, you can take care of your breast. So we'll also be talking about how you take care of your breast. Because if you have a cut and you are breastfeeding a baby, you have a cut as a mother, and you're breastfeeding a baby, the baby's mouth could contain bacteria that will just pass through that cut into your breast. And when it gets there, there is breast milk in your in the breast, so the bacteria can just start acting on that breast, and the breast milk will get contaminated. And before you know it, the child might not even want to suck that particular breast again. And when you now leave it for a very long time, it's turned to pus. You now start having not just only nipple pain, but you still have breast pain. So it's for you to know the kind of pain that you're having. Is it breast pain or is it nipple pain? And what is the cut like? Is it a fresh cut, or is it an old? How do you go about it? You clean. If there is no pus in the nipple, clean the. If there is no pus coming out from the nipple, that is just cuts that you have, you can be cleaning it with a Savlon. Just be cleaning it Savlon, it would go on its own. But if you have anything coming out from it like liquid, pus or milk, you can't just see whether it's pus. You don't know if it is pus or breast milk. See a doctor. Most young ladies that have not even put to bath, they used to see, some of them will tell you that it's breast milk that is coming out from their breast, why it is pus that is actually coming out. It's not breast milk, it's pus that is coming out, and people say, they have infection, breast milk is coming out, but they don't know it's pus. So for those people that are not given to birth, young ladies that are having a liquid coming out from their breast, things that are involved, it could be that you are having long time infection, that a long time bacteria that has entered your breast, maybe through a cut, maybe for those of you that even have, you are sexually active and your partner is sucking your breast, they can pass bacteria into your breast, and the breast will start developing pus, and you imagine that but I've not given birth yet, so why is breast milk coming out from my breast? That thing that is coming out is not breast milk, it's pus. You have infection. It's just like when you have wound and pus is coming out from the distance. So that's what you actually have, and you need to treat it. Most people, when they hear about, at times if you just take like some simple antibiotics, they might go. But you just still need to, if pus is coming out, you need to do a test. You need to do aspiration biopsy let them know what that liquid is, or if that liquid is breast milk or pus. Because if it is pus, they really need to treat it, and they also really need to examine your breast. You understand? So if you have nipple cut, don't be scared. If your nipple is paining you, don't be scared, and there is no breast pain, just the nipple pain, don't be scared. You don't have any cancer, but you still need to seek for professional advice so that you can treat it, because the pain can be so frustrating. If you don't treat it over time, remember, anything can get in there and start eating it up. Anything can get it there, especially because the breast contains adipose tissue. You understand? So you just need to take very good care of your breast. And if you don't even have cut, you don't have this pus we are talking about, you don't have any of them, you can see that does not mean that you shouldn't take care of your breast. Even as a single lady, you should also take care of your breast. You can be cleaning it once in a while, maybe with Savlon, and you just clean your breast and make sure that it is very clean. So if after examining the breast that they find that there is pus, because if there is pus, it could make you to feel intense pain on the nipple. So if there is pus, there is need for them to drain the pus. So it's being done by professionals. So they will drain the pus out from your breast by inserting a needle. It's a professional way, a procedure. So they will draw it out. Then they will give you maybe pain relief and anti-staphylococcus antibiotics to just the pain relief is just to relieve the pain, while the antibiotics is just to kill any bacteria that might still be there. But if you just keep on taking antibiotics if there is pus coming out without draining the pus, you know that the pus will keep on, the bacteria there will keep on multiply, because there is a pus there, and the pus will also be itching you inside. You'll be feeling pain on your nipple because the pus inside. So they really need to remove the pus, then now treat it, because they can't just be treating it when the pus is there. So they need to drain the pus then and treat it. That's when everything, the treatment will now be faster. But if it is not pus, like it is breast milk, so they will do hormonal test for you to know if it is hormonal imbalance. Maybe after you have put to bath, maybe your hormone did not snap back. So they will know also how to control it so that your hormones will be balanced and everything to bath, and you have stopped giving your child the breast, and your partner is also sucking your breast. That moment you also need to stop it, because you are sending a signal to the brain that you are still breastfeeding the child. That's how the system works. The system is not there to know that you are no longer breastfeeding your child, that you have stopped breastfeeding your child, that the person that is sucking your breast now is your husband. The system does not work. It works based on the signal that is receiving. It's receiving a signal that someone is still sucking the breast, that the baby is still sucking breast. So your body will keep on producing milk. So you just need to stop at that moment. You understand? So please subscribe if you have not done so.